CPR, cardiopulmonary resuscitation (CPR) first aid. Cardiopulmonary resuscitation (CPR) is a life-saving technique useful in many emergencies including heart attack or near drowning in which someone's breathing or heartbeat has stopped. Hands-only CPR means uninterrupted chest compressions of about 100 a minute until paramedics arrive. Ready-to-go CPR is begin with chest compressions instead of first checking the airway and doing rescue breathing. Start CPR with 30 chest compressions before checking the airway and giving rescue breaths. CPR can help and keep oxygenated blood flowing to the brain and other vital organs until more definitive medical treatment can restore a normal heart rhythm. When the heart stops, the lack of oxygenated blood can cause brain damage in only a few minutes. A person may die within 8 to 10 minutes. Before starting CPR, check: is the person conscious or unconscious? If the person appears unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" If the person doesn't respond and two people are available, one should call 911 or the local emergency number and one should begin CPR. If you are alone and have immediate access to telephone, call 911 before beginning CPR, unless you think that the person has become unresponsive because of suffocation such as drowning. CPR in 3 simple steps. Call. The emergency dispatcher can assist with CPR. Pump. If the victim is still not breathing normally, coughing or moving, begin chest compressions. Push down in the center of the chest 2 inches 30 times. Pump hard and fast at the rate of at least 100 per minute, faster than once per second. Blow. Tilt the head back and lift the chin. Pinch nose and cover the mouth with yours and blow until you see the chest rise. Give 2 breaths. Each breath should take 1 second. Continue with 30 pumps and 2 breaths until help arrives. Adult CPR. You should check the victim for responsiveness by shaking him and shouting, "Are you okay?" If the victim remains unresponsive, you should dial 911 before starting CPR. To check if the victim is breathing, you should listen for exhaled air. Watch for his chest to rise and fall. Feel for exhaled air. The most common airway obstruction is the tongue. The technique used to clear the victim's airway is to lift chin up, tilt head back. Check for circulation by feeling for pulse at the carotid artery. When assisting the victim with breathing, do not overinflate the victim's lungs. When administering chest compressions, position your hands on the sternum. Give 2 breaths after 30 compressions. Apply the 2 hands 2 inches rule. Child CPR. American Heart Association recommends child CPR for children under the age of 10 to 14 but not infants. If the child is unconscious and unresponsive, you should perform CPR for 1 to 2 minutes before dialing 911. To check if the child is breathing, you should watch for his chest to rise and fall. The most common airway obstruction is the tongue. The technique used to clear the victim's airway is lift chin up, tilt head back. When assisting the child with ventilation, do not overinflate his lungs. The breaths to compression ratio for a child is 2 breaths every 30 compressions. When administering compressions to a child, remember 2 hands, 2 inches. Now coming to the infant CPR. Infant CPR, according to the American Heart Association, recommends infant CPR for children under 12 months of age. Check infant for responsiveness by patting his feet and shoulders. If the infant is unconscious and unresponsive, you should start CPR before dialing 911. The most common airway obstruction in an infant is the tongue. Sniffer's position is the best described as gentle chin lift, gentle head tilt back. When assisting an infant with ventilation, cover his nose and mouth with your mouth. Puff air from your cheeks, not your lungs. Allow the infant to exhale on his own. When checking an infant's pulse, you should feel the brachial artery. When performing compressions on an infant, remember 2 fingers, half the depth of the chest.